Hello, world, and welcome to the For Your Best Self podcast. I'm Dr. Saluja, aesthetic dermatologist and co-founder of Dermatology Plastic Surgery. And I'm here with Heather Dean, and today we're going to discuss non-invasive, next-generation, cutting-edge ultrasound technology known as Sofwave. Heather is a patient consultant on my team, and both Heather and I have experienced a Sofwave treatment. Lucky us, right? Welcome, Heather.
Thank you for having me. I'm so excited to talk about our experience with Sofwave together.
Our treatment with Sofwave is designed to lift your eyebrows, your brows in general, your face, your neck, and it's really designed for the active patient who wants zero downtime. It's great for our patients who have a little bit of loose skin or lax tissue. I know we all always point underneath the chin because we either have loose skin or we're worried about it, or we want our brows to lift. So it's great for patients that have a little bit of loose skin or lax tissue. Heather, what did the Sofwave device look like to you?
So when I first saw the device, we rolled it in. It looked like honestly like a big computer on wheels. It had a handpiece wand, kind of like a laser. Radio frequency device, if most patients know what that looked like. Pretty easy to stand out for most patients.
Okay, so there's the device, and then who did the treatment on you?
Our wonderful PA, Brittany, and then our esthetician, Tanya.
Yeah, so I think one did mine, one did yours.
Yes.
And so we have the device, we have the operator. Both are important to the treatment process and the experience. Did you have to do any prep for the Sofwave beforehand?
So, like most of our treatments, we want to come in with a clean face, free of makeup and skincare products. So when I came in, we took before photos because it's always great to track progress, especially at the end points to take after photos. But we cleansed my skin again, and then we applied our topical numbing cream, and then I just sat in the chair and relaxed for about 45 minutes and got ready for the treatment.
Yeah, so no prep really other than that makeup, skincare free face.
Correct.
And then you don't have any metal implants in the treatment area, right?
I do not.
Neither do I, and otherwise that's a reason to potentially consider another option.
Yes.
So you got cleansed, you got topically numbed. Did you get your ibuprofen?
I did.
800 milligrams.
I did take an
Okay.
ibuprofen beforehand.
And then 30 to 45 minutes you waited. And then what was the treatment process like for you after?
So during the treatment, I can say for myself, I think I have a pretty high pain threshold. But after doing that, I know I'm a little sensitive to heat, temperatures.
What did it feel like?
So it felt very warm, and the warmth kept building up until it got to a point where you're thinking it's going to be a little too warm, and then you get a break, and then the wand piece moves on to a different section of your skin.
Okay.
But it wasn't anything that wasn't too intolerable. Like it was.
Would you do it again?
I would definitely do it again. Like sign me up next year.
Yeah, same. I'm thinking like I don't even know if I want to wait a year.
Yeah.
So you had ultrasound gel?
I did have ultrasound gel.
Okay.
For the wand or the handpiece to glide over the skin, you want to make sure you have enough ultrasound jelly on.
And then how did you look after the treatment was done and the ultrasound gel's wiped off?
It looked like I had nothing done. Like I could have went about my day, went shopping. My face felt a little warm, like I was out in the sun a little, maybe too long. But looking at me, I looked like normal without makeup.
Awesome.
So it's a great treatment for patients who want no downtime. They can take off work a couple hours early, come in and get treatment, and then go back to work the next day and have no...
Yeah, there's very few things in aesthetics that we can say
no
are
downtime.
like that, that are absolutely
I loved it.
looking normal.
Mm-hmm.
No restrictions with the dentist either. Sometimes we say
Correct.
with injectables, hold on dental for 2 weeks, or we say, if I injected a filler, hold on air travel for 2 days. All of the restrictions with Sofwave don't exist, so it's great. For me, the treatment also felt hot, and it was like a peak, and then it relaxes. I took additional medicine because I like to feel very little pain if possible. So I would rather over medicate than under medicate. So I took what is called an MKO melt, and I dissolved it under my tongue, and then it had sort of kicked in within 15 minutes, and that made it very comfortable for me. If a patient elects that option, then we ask that they have a driver. And the effects of that medicine wears off in about an hour and a half, so it's not long lasting. So again, you can really go back to your regular activities.
Yep.
The heating effect, that sensation we're feeling, actually leads to a healing response in the skin. And that leads to new collagen and new elastin being produced. And so from that new collagen and new elastin, we see a reduction in fine lines, and we see lifting, and we see firming of the skin. And that's what makes you appear more youthful. The awesome thing about Sofwave is that it's long lasting. So only one treatment's recommended. You don't have to do a series of treatments. And usually one is recommended per year. And why is that? It's because we continually age. So it's not that the new collagen and elastin suddenly are gone in a year. It's that we're continuing to age. And as we do more aesthetic treatments, our standards also increase. And so then we say, okay, we want to do this again because we want to experience more tightening, or we don't want to, or more lifting, or we don't want to have another year go by where we're adding on to the aging process. The Sofwave benefits don't appear right away. They usually start appearing at around 2 weeks, and then the benefits continue really maximally at about 3 months, or at least a lot of benefits by 3 months. But in some cases, even 4 to 6 months, you can continue to see improvement. And so a motivated patient who might want a second treatment, I would suggest waiting at least 6 months, and then otherwise generally annually. The other interesting thing is that all skin colors, right? You're a skin type.
Yes, it's colorblind.
I know. You're a skin type. What would you say? We have 5 skin types in dermatology.
I would say I'm a 2.
You're a 2.
2 to 3.
And I'm a skin type 5.
Yes.
And so we, one of the things we do when we see our patients is type their skin. And for example, laser resurfacing cannot be done in my skin type, but can in yours. But the interesting thing about Sofwave is that all skin types can be treated with Sofwave. And so that makes us, that really makes this device all inclusive. And we call this category inclusive beauty, meaning the type of your skin or the color of your skin, the type of skin you have doesn't matter for Sofwave to work, because it's really working in the second layer of skin where the pigment is not really an issue. We're bypassing the top layer. So tell me what your progress has been like. What have you noticed?
So I have noticed a big lifting in my submental area, which most people would call their double chin. But that has completely tightened up. It's continuing to get better. It's hard to track progress when you look at yourself every day. That's why we love to take photos. And I took a photo yesterday and compared it to my initial photo, and all I can say is wow.
And check out our social media at Dr. Saluja _ Dr. Novo, because we'll post Heather's before and after. It was pretty impressive.
Yeah, it's been about 8 weeks. So, I'm still going to continue to see results, but my jawline is much tighter. My marionettes are starting to lift, and my nasolabial folds are nice and tighter too.
It's hard to compliment yourself, right? But go for it.
Yeah.
Compliment yourself.
Like, I can tell a big difference. I'm pushing on 40. I'm not quite there yet, but I'm almost. And I have taken good care of my skin, but I will be honest, I've neglected my neck. And that's one thing I've really wanted to focus and hone in on this past couple years, is really taking good care of my skin quality and doing treatments like Sofwave or other modalities we have in our office.
And you're a good candidate for Sofwave. I like that you said you have healthy skin. I think for our patients that are very sun damaged, laser resurfacing is the first step, or something called broadband light, where we remove the reds and the browns and get the skin healthy, getting on skincare so the skin can actually respond and produce collagen and elastin. So once the skin is in good shape, then Sofwave is the next step.
Yes.
And typically we treat people who are in their 30s or older. And really what we're looking for is mild to moderate skin aging and mild sagging and some fine lines. I think there is a period where the sagging can be severe, and really then we're looking at our plastic surgery interventions or our more invasive interventions, even if it's not a face and neck lift. We also, in a lot of patients, add additional treatments to optimize jawline and neck rejuvenation. So can you tell us a little bit about those treatments? You know, I've added Botox to the my platysmal bands and done something called a Nefertiti lift in myself and obviously in a lot of our patients. And that helps this, you know, obviously Sofwave's working on the skin. So the Botox, Dysport, Daxify, all similar products in terms of the effects are really working on the muscles and that muscle tone, and so that the muscles that are pulling down on the jawline and neck get weaker, so the muscles that are pulling up are relatively stronger, and we get better jawline definition, less banding of the neck, and a little bit of a lifting effect as well. Other things that we recommend to patients in the rooms?
Yes, so we always focus on skincare too, because like Dr. Saluja said, skin health is really important. We always recommend one of our favorite product lines is Elastin, because it has Trihex technology. So if we're focusing on the neck, we recommend Elastin Neck for that. It helps get rid of old damaged collagen and regenerate new collagen in the skin. So we always pair that with a treatment because it's been studied with treatments. Another thing that we like to complement Sofwave with is hyperdilute Sculptra or Radius, which is our biostimulators. And so what Sculptra is it is a polylactic acid. It helps stimulate collagen in the skin. So it helps with crepey skin, which is something that I'm starting to get. So now that I have Sofwave with helping with the lift, I will, move on to the next step and do something that we are offering in our office called Trinecta. So we're doing Sofwave for lifting, and then we're going to work on crepiness with the biostimulators, and then work on the neck bands with the neuromodulators.
Yeah. Then the interesting thing is, we think of fillers as adding volume, and you can actually use the fillers to stimulate your skin and not add volume. And the beautiful thing about the hyperdilute Radius or Sculptra is you can take a syringe or a vial, mix it with more saline than you might traditionally mix it with, and for the face. And when you're using it on the neck or body, it improves crepiness and the sort of the thinness, and promotes
like the structure.
It improves the structure.
Yeah.
You're right. You're absolutely right. And then, of course, can't forget sunscreen. We should be remembering sunscreen on the neck if we're outside longer than 20 minutes.
Right.
Can't have a podcast about skin without sunscreen. And then also we should be thinking about our neck position as it relates to technology. And that's probably the hardest. Yeah. Really, that's changed. It used to be sun was the hardest thing to avoid, and now it's tech neck.
Yeah, tech neck. Now that you mentioned that, I read an article over the weekend, and it says since the pandemic started, we have increased our screen time by 33 to 185%. So by looking down, we're putting 10 to 60 pounds of pressure on our neck. So with that being said, we have more collagen loss, more lines, more thinning. So after reading that, I feel like I'm going to be looking up a lot more.
Yeah, right. Trying to hold our devices at eye level as much as possible. And I think, or taking breaks, right? When we're at our device, we've got to remember to take the break from looking down, look up. And, every 20 minutes, just like we're trying to rest our eyes from a screen, we want to rest our neck.
Yes.
So like I was saying, sometimes it's a little bit more, the aging is a little more severe, and sometimes patients need something more invasive to see a significant benefit, especially with advanced aging or if the problem's beyond mild. And the great thing about our practice is that we work synergistically with plastic surgeons, and they do additional neck procedures such as something called Renuvion and something called My Elevate. And of course they do face and neck lifts. And sometimes our plastic surgeons perform these more invasive treatments. So maybe you start off with My Elevate or a face and neck lift, and then you use Sofwave after annually to help maintain the lift. So, there used to be a time where people would get their facelifts and they say, well, I'll get my second one in 10 or 15 years. I don't think you have to get a second one ever now. You can always do maintenance treatments after your more invasive treatment to maintain that face and neck lift for hopefully the rest of your life.
Yeah, now that we have Sofwave, yes.
Yes,
And that's what
wonderful.
I love about our office is because we offer so many different type of treatments to customize for each patient's needs.
Yeah, that's important. I think customization is important, and I think having options, although options can be confusing, that's why we're there.
We have
to
a
have
team of experts. Yep.
So last I just want to cover is Sofwave Safe. The safety profile of Sofwave is strong, and there were no serious events reported in any of the studies. Part of the reason is that there is an integrated cooling mechanism that protects the uppermost layer of skin from burning. So the uppermost layer of skin does not feel the heat, and that greatly diminishes any risks. There were no device-related adverse events reported in any of the clinical studies again, and I think that's again another rare thing that's nice to know. Heather, anything else you want to add that I may have not covered?
We just touched on it briefly, just, preventative maintenance. I feel like this would be a good treatment to start, maybe in your later 20s, because our we start losing collagen around 18, 1% collagen loss. So if you want to get ahead of aging and be more proactive and preventative, let's start early.
Yeah, I agree with you. I think there's never really a thing such as taking care of your skin too early or too late.
Yeah.
And I think we shouldn't pass judgment on people coming in their 20s to start, nor pass judgment on people coming in their 70s and 80s to start. Because life's different for different people. People have time at different periods. People have the financial resources at different periods of their lives. There might be different life events that happen where now it's time for our patient. And I think obviously starting younger is better. Preventing the line, preventing the sag, preventing discolorations, all much easier to do than when we react. On the other hand, I think that some of my most rewarding patients have been also patients that have maybe, everyone's grown up and out of the house and married, or now the gentleman is finally retired and is ready for himself. And I think that's also a great time.
Yeah, take care of yourself.
Yeah,
True.
great time. So I want to leave us with Sofwave is really the best-in-class treatment. It has high patient satisfaction. It has zero downtime. It is safe for all skin types. It does not get to the fatty layer of the skin or the tissues below, so we do not have to worry about it dissolving fat or dissolving filler or affecting muscle or affecting bone. It is designed for the skin. And so I want you to come see us for your best self and see how Sofwave can help you. Thank you, Heather, for doing this podcast with me.
Thank you for having me.
We invite you to call us at 321-241-1160 for more information.